Madam Deputy Speaker, and can I start by congratulating my honourable friend, the new member for Slough, on a really excellent maiden speech. It was a privilege to be here for the first maiden speech by a brightly coloured turbaned Sikh. Congratulations on that. And I'm looking forward to a number of maiden speeches today. In my own maiden speech 2 years ago, I said that amongst other things, I'd look forward to arguing for reform of our drug laws. There's been very little chance since then, so I welcome the debate today. But unfortunately, I do believe the government's new drug strategy is a massive missed opportunity. We don't get a new strategy very often. There's always the hope that it might contain some radical thinking. But this, I'm afraid, is a strategy that sadly offers little that's new, is more of the same approach that isn't working, that has seen an increase in drug-related deaths in the UK, that sees the UK responsible for nearly a third of Europe's drug deaths. Madam Deputy Speaker, my friend Cara's son is 5 years old tomorrow. It will be his third birthday without his father, Jake, who died of a heroin overdose. Cara wants to legalise drugs to end the stigma around drug use and to end the unnecessary criminalisation of drug users that made it so hard for her family to deal with Jake's addiction and makes it more difficult people to seek help with drug problems. The day after tomorrow, Thursday, will be the 4th anniversary of the death of 15-year-old Martha Coburn, who died after taking ecstasy, which turned out to be 91% pure, and as a result of which she died of an accidental overdose. Martha's mum, Anne-Marie, who I think is in the public gallery today, now campaigns for the legalisation and regulation of ecstasy, amongst other drugs, because the reason Martha died is because there was no controlling measure on the substance that killed her daughter, and no way for Martha to check the safety of the substance that she was using. Martha was failed by our approach to drug policy. Many people who have been touched by the loss of loved ones want a more measured debate, a more rational approach to drug policy. 50 people a week are dying of drug-related deaths in the UK. 50 Marthas and Jakes. Our first duty in this place has to be to try and keep people safe, and we're failing. And the biggest missed opportunity in this strategy is to not even consider decriminalisation or legalisation of some drugs as solutions to the problem. We've heard a number of times already today about Portugal, where they decriminalised in 2001. They have a drug-induced death rate that's 5 times lower than the EU average. They had 16 overdose deaths last year, and HIV infections have reduced massively. Madam Deputy Speaker, in an article last week on the publication of this strategy, the Home Secretary said, "We owe it to future generations to work together for a society free of drugs." Talk of a society free of drugs is, in my view, a dangerous fantasy. It's a fantasy because humans have taken drugs for thousands of years and aren't going to stop because the Home Secretary produces a new strategy. And it's dangerous because it diverts our attention and resources from the real challenge, which is how we make drug taking safer, how we educate users and reduce the consumption of dangerous drugs, and how we take control of the drug trade from the criminals who want to exploit vulnerable users, and how we stop criminalising many thousands of people unnecessarily. In the case of a lot of people, they're being criminalised for a medical or psychological problem. We need to recognise the link between early childhood trauma, including abuse, and addiction in later life. It's a closer link than that between obesity and diabetes. Drug addiction is very often a psychological or biological problem, and criminalising people who have those problems is not the answer. And in other cases, we're unnecessarily criminalising people for using a relatively harm-free intoxicant, and the best example is cannabis. It's surely wrong that we criminalise people for using a substance less dangerous than tobacco or alcohol, a substance that the overwhelming majority of people find pleasant, relatively harm-free and even rewarding experience. We have all-party parliamentary groups which extol the virtue of beer and wine and whiskey, But when we talk about a substance which is less harmful than alcohol, we're not allowed to say that it can be a positive experience. I'm happy to give way.
The gentleman was making a powerful speech, but I regret to say it is wrong in one particular regard. The Royal College of Psychiatrists has made crystal clear that cannabis is an extremely dangerous drug which can be a gateway towards mental health difficulties. Doesn't he agree with me that if you were to decriminalise it, it sends a dangerous message to young people that cannabis is somehow safe? Nothing could be further from the truth.
No, I don't agree with him, because I don't think that's the evidence, and I don't think that's the message. And certainly, there is a whole a host of evidence through the years that cannabis is far less dangerous than alcohol. Yeah, happy to give way.
Isn't the problem that when you're buying in the criminal market, you have no idea what you're buying? You could be buying a very heavy strain, whereas if you regulate, then you have control over the potency of the substance that we're trying to control.
That's absolutely right. We talked earlier on about the use of skunk, and skunk has a very high THC content. You regulate the cannabis market, and you can balance the THC and the CBD elements of the product that you're producing, and make it safer for people. Yeah.
The Honourable Gentleman is making a very informed statement, but would you agree with me that it's cannabis sativa and cannabis indica are totally different drugs to the skunk that we're talking about? And the experience we have in the Western United States is that you can have a perfectly civilized purchasing system for cannabis sativa and cannabis indica. And may I possibly appeal to the more avaricious elements upon the government benches to say it is a vast revenue stream of taxation which surely should delight even their dark hearts.
I absolutely agree with my honourable friend. He knows it. I suspect very many people in this House know it. Far more people, incidentally, than are represented here today. Plenty, I think, of people on the government side know it. Maybe even the Home Secretary knows it. But because of the toxic climate of the debate around drug policy, we're not able to say so. If we legalised and regulated cannabis, we would take it out of the hands of the dealers. We would reduce the opportunity for dealers to tempt users into experimenting with more dangerous drugs. We would regulate the products, as my honourable friend says, so users know with confidence what they're getting, so people who are worried about very high levels of THC don't have to take whatever they can get on the street. And as a bonus, we would raise many, many millions for the Exchequer to spend, if that's what we desire, on drug education or the NHS. Around the world, countries are recognising that cannabis prohibition is failing, and many countries are regulating. Uruguay was the first. 8 states now in the US, representing 20% of the population, have legalised and regulated, and next year Canada should become the first G7 country to do it. It's time we did the same. My personal belief is this is going to happen. It's inevitable that it's going to happen in this country. We just need to grasp the nettle to do it. We desperately need to change the terms of the debate. We need more openness and honesty in discussion of drug policy. We need to reduce the stigma around taking drugs so that families find it easier to discuss the problem and to find help. And we need to stop the pretence that all people's experiences with illegal drugs are negative. In my previous life, I worked as a DJ and an event manager in the music industry. So I spent a lot of time working and socialising in nightclubs, and I've spent a lot of time around people who use recreational drugs. Many thousands, probably hundreds of thousands of ecstasy pills are taken every week in the UK. And we can't pretend in our public discourse that people who are taking drugs do it because it's a terrible, miserable experience. Because people won't believe us. It will just destroy the credibility of the message. So we need an honest, rational debate around drug policy if users, and especially young people, are going to take us seriously. And most of all, we need to focus on policies that minimise harm and minimise risk to those users. And that means looking at different approaches to harm reduction. And that's where this strategy is so disappointing. The government has ignored the chance to do this by looking at interventions which can save lives, at drug consumption rooms for heroin users, at heroin prescribing, at pill testing, and we need a much stronger emphasis on educational solutions where people are caught breaking what is currently the law. If I get caught speeding in my car,